very much to the organisers, to Thai Health, to the Ministry of Public Health, to TPAC, and to the many others who have organised this conference for the great pleasure to join you for this second meeting on physical activity. We have got a lot to learn from our previous speakers, showing us how to lead, showing us how to implement, showing us the importance of family, showing the importance of using all of the tools that are available to promote physical activity. It's my very great pleasure to have been invited to share with you where the work of Thailand fits in to the global picture on physical activity. Now, I know we're a little short of time as well, but I hope to share with you what's going on globally and challenge you and the work in Thailand to contribute and to see how we can create the active world that we are all so inspired to work towards. I'll present a global view of what is happening, where we are today. And like Dr. Udmansil, I'm optimistic. At the start of 2023, we are in a good place, but we want to make it better. I'm going to signpost tools that you can use. I'm going to show you progress on the global agenda. Where are countries like Thailand, but 194 countries there today on promoting physical activity? And I hope to leave you inspired and with things you can do, whether you're in the research, the health, sport, transport, a practitioner, or an academic. Everyone in this room has a role to play. Now, it's not sequential, but across the presentation, I hope you get these 4 aspects. The good news is, this is my last slide, as in, it's the last one brought to the beginning. I want to leave you with the main message: we have to implement, implement, implement. The good news is we know what to do, but we have to do more of it and evaluate. That's why the researchers and academics in the room are important. That's why the ministries all want to have, and Thai Health in particular, want to have the evaluation. We must do this. Number 2, advocate, advocate, advocate. These are related, because if we want to implement, we need to have the tools, the resources, and the people to implement. And we need to therefore get the political leadership, the financing, and the support. And we need it at the local level, and at the global level, and all the way in between. Everyone has a role. We have data, but we could do better. And we need to strengthen that data. And I'm very excited to see on the program some of the things you're going to be doing, you are doing, and how I hope we could extend those globally in strengthening our data systems, to use the data in what we do and build the data. And lastly, and why we're here today and tomorrow, is to share knowledge. We can't reinvent the wheel. We have to learn and share what's happening locally, across the country, in different provinces, regionally, in your neighbouring countries, and then globally. I hope my presentation will show you why these are my 4 take-home messages for you. So where are we today? Well, this slide shows you an extensive array of the global tools that we've got. We've heard a lot already, so thank you to my previous speakers. On the far left, we have a global roadmap. We know what to do. The Global Action Plan, developed with your help and others, contains the direction and the tools. And we've had that explained by Dr. Pirro, the strategies that we need to implement. We know where we're going. We want to increase. We have a target. We can therefore measure, and I was delighted to see the slide and the modelling that you were doing about how to get to that road. But that gap between business as usual and reaching the goal, what fills it? You. It's what you and we do. In the middle, we have the science. We have the guidelines. You also helped in that process, developing global guidelines and then adopting and developing your national guidelines, confirming the science, confirming what we've heard from previous speakers, including the previous speaker, on the mental and physical health benefits of physical activity. We have the tools that WHO is developing, and I know you have similar and different tools at a local level. I'll come back more to those. And then you may or may not have seen, we have developed tools for advocacy. We've heard the impact of COVID. We've heard that it affected how much, where, when, who can move. And we saw the data here in Thailand from that slide earlier. We have to recover. And we have to rebuild. And this advocacy tool, Fair Play, available on the website, calls for that. More investment, renewal, and building forward on physical activity to help recover from the impact of COVID. And there's an audio of an 8 webinar series. So we have come to this point with all of these global policy tools and guidance to help countries. But just last year at the end, 2 new tools, and I'll be speaking about these each. The Global Status Report, where are we globally with countries doing what I've just outlined? And as help advocacy, a new price tag, estimating the cost of not acting on physical activity. I'll come to that later. But for a moment, let us pause. If this is where we are, how did we get here? Let's learn from the past. And we learnt from Dr. Udmansil about how he contributed through his own work, his own leadership, not accepting no, how Thailand got to being a running nation. However, we need to look at how we got here to help us so we can go forward stronger. And the one point to mention about that is one development. We're looking in a bicycle rear view, not a car. Some of us may remember a very early stage of global work on physical activity. The slide is rather empty. There was a document called a global policy or global strategy on diet and physical activity in 2004. There were a few tools later in 2006, and finally the first guidelines in 2010. Progress was not fast, and progress was not at scale. We recognise that, and the Global Action Plan on Prevention and Treatment of Non-Communicable Diseases, the UN political declarations, a lot of global advocacy led us to a global agenda to address the risk factors of physical activity. And because of the earlier work, physical activity was included in that. And that is why we have the goal for 2025, a goal I think Thailand may be on target to reach. But in addition to previous policies, we had the science. And this is why it's important here in Thailand, being driven by and using the science. Studies which culminate in landmark papers, special issues in the Lancet. It happens to have been published in each of the Olympic Games years, 2012, 2016, and 21, saying, well, if we celebrate sport, we must work on sport for all and physical activity and health. Exploring and summarising the science on urban planning and transport and health. 2 Lancet publications. On the far right, the science of measuring physical activity, and very recently, the cost of inaction on the bottom. And we have advocacy which we've heard about, advocacy which Thailand has played a key role in contributing, not least with the Bangkok Declaration, making the link that physical activity is not just about physical activity. Physical activity is not just about health. Physical activity is a means and a tool to multiple societal agendas, the SDGs. And of course, as Dr. Pirro outlined, the rubric was already there before the Global Action Plan of 8 key settings for interventions. So history has brought us to where we are today. And today, with a Global Action Plan and WHO and Dr. Tedros, the Director General, supporting the role and importance of physical activity. You've heard about the Global Action Plan, and you know it's built on 4 pillars. And Dr. Pirro outlined those 3 strategic intervention areas: communications, environments, and programs. But the 4th makes it happen, the active systems. And it's not just about sport or running, it's about movement in all ways for all people of all ages and all abilities. And that I emphasize. Thailand must not proceed forward, leaving others behind. So we need to make sure our look left and right, everyone is moving forward. And we'll ask ourselves about that progress shortly. You know, it's not just a menu to take 1 or 2 items. This is a menu we build as a whole picture, a whole system. They're interconnected. The grey lines are as important as the circles. It's all of these working together for synergies. So when a school is promoting physical activity, transport and the environment is making sure walking and cycling around schools is effective, safe, and efficient. In the parks and the schools and the healthcare, it's not one or other of these strategies or settings. We build a systems approach, which is why all of you have a role to play. We know from the guidelines, every move counts. And we know that we want to get more people more active. But we also know that sitting, as has been outlined, is a health risk. The most important place is that first curve, the curve from getting moving up to the recommended range. There are more people in that range. We have to help them get the benefits, and then we worry about more people doing more on the far right. Let us remind ourselves what this would look like. People being active, all ages, all abilities, in all different ways. That's our goal, every day. We've got lots of guidelines, resources, but these must not stay on a shelf. They are for you to use in advocacy, to use as the arguments and drive your program. You can read more, listen more, and access all of these materials to use. I showed at the beginning, to use, we need to start implementing. So WHO has been developing toolkits. If we need a systems approach, we need to understand what each part of the system is and how to connect it. So we're developing for you to use toolkits, taking the best evidence and simplifying what exactly is it that we must do in primary healthcare. I'd like to ask you, have you received advice, or reinforcement on being active by a health professional in the last year? If so, please put up your hand. I'll need some translation maybe. I'm asking you if you personally have received advice on being active or supporting you to be active in the last year. And I'd like anyone in the room to put their hand up if that has been the case. I'd like a photograph of the room. Because Dr. Pirro, there is not a single hand up. Maybe one lady is thinking about putting a hand up. Yeah, half. Okay, so let's see if that's true. Please put your hand up if you have. Do you remember my first guideline or recommendation from this meeting? Implement. Dr. Pirro, we have the tools. We have the policy. It's not happening. But you're not alone. I didn't put my hand up. I've never had advice from a health professional. We have to think about that. Why? Have they not been supported, trained, helped to know how to ask, assess, and provide that advice? The toolkit is providing not just what the practitioner should do, but what the health system should do to make that happen. And that is the responsibility of the health system, but not alone. What should happen in schools? What should a child get every day in school? The opportunity to be active, the opportunity to walk or cycle to school, the opportunity for physical education, the opportunity after school to enjoy being active. Are your children getting all of those opportunities? The toolkit gives the guidance on what, but also on how do we help the education system deliver that. Again, you all have a role, this time as parents, as citizens, as well as many of you in the education sector. We're also developing new tools that you could help us. How do we do best practice communication campaigns? I congratulate you on the opening video. Bright, energetic, informative. We need best practice communication campaigns to make sure physical activity for everyone in all ways is seen, and we shift the norms of culture. The norms where we sit in conferences to the norm where we're active and standing in conferences, etc. The advocacy tool I mentioned is powerful. Its primary message, physical activity is a must-have. It's not at the end of the government list. That would be nice to do when we've got time and money. It is at the front of the list because of the Bangkok Declaration, because of the links that physical activity has to health and health budgets, to education and learning, to transport and reducing emissions, car traffic, congestion, and therefore productivity, to the economy because of all of the above. Physical activity is not a nice to have for some people, typically more affluent. It's for everyone. Apart from saying that, it has three messages. Fund. We do not align our funding to our messages. Is there enough equipment, education and training for physical education and active sport in schools? Is there enough funding and infrastructure for walking and cycling, requiring streets to be safe and supportive? Or is it a nice to have? Some streets will have a cycle lane. Some communities, in some parts. Can everyone get to a local park where they could be active so it's convenient and inexpensive? Dr. Pirro, I think you said it took 60 minutes. 60 minutes? We're not making it easy, convenient, affordable. So we have to use regulation, policy, and do better. And doing better actually means doing better together, because I think there are examples of all of the good things. But why can't we connect them up? so that the good things are connected and then they multiply. And then everyone's working together, not in silos. This is what people told us. And the videos from the Reinvent webinar series allow you to listen more, and I encourage you to do this. So I started being very positive, and I am, because we know what to do, we know where we're going, we know how, we've got some of the tools, we do need more. So how is the global progress? Well, I introduced those two last products, and I want to take a few minutes to go into more detail. Firstly, the Global Status Report. This was called for back in 2018. Tell us how we are making progress. WHO, my unit, took this on board, developed the indicators, and from the indicators used global data to track 194 countries. This is more of a logic model. Some of you might like this way. It takes the systems and points to how we have to have the implementation, the active system on the left, governance, policy, money, training, to implement the three strategies Dr. Pirro talked about, that you have examples of here, but I think we need to do better. It's only by implementing those we will change physical activity. And it's only by changing physical activity we will deliver what we say: better health, economic gains, productivity, better learning, impacts on the environment. We cannot claim the far right unless we do the hard work. So whilst GAPA is a system, it is all about implementing what we know works. So let us hear, and I got help to summarize the report.
We know that being active is good for us. The World Health Organization's global report on physical activity is out now, and let me tell you, it's a bit of a wake-up call. Oh! Progress is too slow. It's uneven and unfair.
It's because of significant gaps in policy implementation.
Exactly. But let me show you what things could look like with a few changes. Look around. People are active everywhere. Keep moving, everyone. You're doing great. We hear about the benefits of physical activity all the time. We encourage walking and cycling for transport and fun. Look at these streets. They're designed for all people.
Whatever your speed or ability.
When we say physical activity keeps you healthy, we really mean it. Schools encourage physical activity every day, and it stays with us for life. Physical activity guidelines and targets are set to drive policy. That's a bit literal, but nice shot. So I know what you're probably wondering.
How can this become a reality?
Great question. Governments need to see the value in physical activity. They need to prioritize it, fund it, engage with local communities, and collaborate with partners. Invest in best practices to implement new policies. And use data to drive decisions. We need to come together to increase physical activity and improve our health, which can save us $27 billion every year. Enabling physical activity is an investment, and it pays off. This should be the reality everywhere. The choice is ours.
That's a 200-page report in a 2-minute video. Not easy to do. It was jam-packed with messages, and I know this audience will have heard many of those political messages, not just the fun of the particular way and style. But you heard at the end a price tag. I will come back to that. You heard about more data, using what we have, but filling what we don't have. You heard about the need to come together with leadership and partnership, many of those themes. The report is available, and I hope you will use it. Let me just pause and go through, if time allows, a little bit of those data, because the opening told you progress is slow and uneven. Let me talk you through this slide. Using a traffic light system, green meaning that over 75% of countries are doing it, it being the indicator. And we have 36 indicators. Yellow means halfway, and red means less than half. The summary out of 36 indicators is that 20 of them, over half, are not being done by half the countries. So we know what to do, but half the countries haven't started doing it. That's progress is slow. Worse, only 9 of the indicators are being achieved by over half, but not yet 3/4. And just 7 indicators are being achieved by 75% of the countries. So join me for a moment and look at the world from a bird's eye perspective. We know what to do, and yet we're not implementing it. That's the policy gap. Implementation gap. And it may be true here. And I have to say, my quick poll of primary healthcare suggested, at least on that one, there may be a policy implementation gap. But it was uneven. And what I meant by that, and is summarized in the data and shown in many, many slides, is a pattern. And the pattern is that more high-income countries are doing more of the policy than middle and low income. Some regions of the world are doing more than other regions, and they're correlated because it's the high-income euro that was doing more, not always, but mostly, than Africa, which is mostly low income. So at the global level, we see progress is slow and progress is uneven. And we've got to get going. In fact, the very words of Dr. Tedros were, let's get moving. And he meant moving on policy implementation as well as moving on ourselves. Very quickly, because this may overwhelm you, but if we took one of the areas, active societies, implementing mass media campaigns and mass events that can engage the community, motivate, show, and support, half the countries are doing them. If we take the environments that can create the places, easy, accessible, safe, in the local community, so that people can walk and cycle and play in public open space, well, we're doing quite well on legislation, and you do quite well on legislation here, for road safety. Remember, red, less than half. The numbers are less important, although they're important to me. We want to change those. We want this all orange and then all green. No red. That's less than half of the countries. And Zero, as a region, Southeast Asia, has got work to do. Another slide of red. There's lots here. Childcare, primary healthcare, parks, walking, cycling, work site. I'm listing them all, Dr. Pirro, from strategies. Half the world is not yet doing the strategies. You may wonder why I'm optimistic. Again, we have a little bit better here, because what we have made progress on is getting policy and to some extent guidelines. More countries have got policies. I'm pleased to see that physical activity is in NCD policies. However, if we ask about a very specific physical activity policy, which is being implemented, We dropped to 47 for having a policy, and in fact 36% of countries for it being implemented and funded. Cup half full. Progress on what we need to do, but let's remember, if the government doesn't acknowledge physical activity, how do you get the conviction and the funding and resources to implement? So we have to work in tandem of both policy to drive change, but also action to drive policy. The report has 5 recommendations. You heard them in the video. We need to implement, we need partnerships, we need data. There are data missing. We do not know what is happening in schools. Health promoting schools is one window, but it's not used globally. Health promoting work sites could tell us work site data. It's not used globally. We don't know what's going on in parks. We don't have data in terms of access to parks, availability, and meeting communities' needs. We know cities are an engine of change, but we don't know what's going on. We have piles of indicators, a handful of indicators, which we do not know because we have no data to measure. So the researchers in the room, I would be delighted to talk with you. Funding and ownership. And I shift now from leadership to ownership in the interest of time. We all need to own what we can implement. If you work in the schools, that's where you can make your greatest impact. If you work in the health system, we cannot stand here and talk to everyone else. We have to own and start delivering our bit. That's the system approach. And health needs to recognize its role in supporting, but also delivering its own element. My last point, I introduced a price tag. The video was a spoiler. It told you it. $300 billion US dollars. Let us think about the future hypertensive patients, the future diabetic, the cardiac, coronary heart disease of next year, the depression, and the dementia. If we think about the diseases we say physical activity prevents, we can cost what those future cases will be. 500 million cases in the next 10 years to 2030, and $300 billion to public healthcare systems. Not personal costs, not workplace costs, not private healthcare costs, public purse. We're going to pay for those diseases because we didn't prevent them. We need to get savvy in our advocacy. We need to use numbers. We need to use economic data. These data are powerful and available for your country and others at the national level each year out to 2030. It's a large number. And now physical activity can say, we know what to do, we know how to prevent, and we know the cost. Let's use that for advocacy. The tools are all there for you, the website, the resources, the video, the country cards, the cost of inaction, and even a podcast. My take-home messages, I started with this slide. What can we do? What can you do? Implement. Time is short. 8 years to 2030. You will not change the business as usual to get to the desirable or to reach the goal unless we implement at scale and evaluate. Advocate for more money, advocate for better alignment, advocate for more personnel, training, and capacity. We cannot do this on nothing. It doesn't actually cost a lot to implement, but we need advocacy for all of that to happen. Data, I've mentioned, and this is the most important, and where I am delighted to be here to learn from you over the next few days. Globally, we need to share what does work. It was mentioned in the Cost of Inaction webinar. We need to work on the arguments of the heart, the mind, and the pocket. We have the mind. We know what to do. We have the pocket. We know it costs $300 billion, $27 billion a year. We're spending that next year. and the year after. We need to work better on the heart. Powerful examples, like I've seen some of those already in the presentations this morning, and I hope will be shared. But globally, we need to show leaders at all levels of the community and globally, we can do this, and this is how. Because people want those stories. They want to see the progress being made. So I leave you with these take home. I hope each of you can identify which one of these you will be contributing to. Maybe more than one, which I hope. Thank you very much.